Right, right. No, I only have like literally three out of state. Ready? Okay. To update residents on COVID-19 in our community. So I want to start by reminding our listeners and viewers today that we have powerful tools. We continue to have powerful tools to fight against COVID-19 and its variants. We have tools such as testing for all ages, vaccines for ages 5 and up, and booster shots for ages 18 and up. The Pfizer booster eligibility was lowered to ages 16 and up. So last week I reported that the flu has not greatly impacted Texas in the way it has in surrounding states. That is not the case any longer. Doctors have noted that flu season has started. The numbers are increasing in Texas, and we know that. Both COVID-19 and flu cases could rise as more people are traveling and gathering during the holidays. So we ask you to continue to be vigilant and follow our CDC, or I should say, follow those guidelines, but remember that the CDC and World Health Organization, they continue to remind us to follow their guidelines, which include vaccinations, regular testing, social distancing, and frequent hand washing as effective ways to combat the virus from spreading. While hospitals are seeing a slow uptick in COVID-19 cases, doctors still strongly encourage residents to get their flu shot and a COVID-19 vaccine. Anything that you can do to help yourself and your loved ones stay out of the hospitals is much appreciated, and it's what we can do to keep any hospital from being overcrowded. As of yesterday, there have been 2 geosequence cases of the Omicron variant identified in San Antonio. According to the City County Health District, and those are in addition to a few cases identified in Houston and Tarrant County. The Omicron variant seems to have a weaker disease process than the original coronavirus and other variants. And in a moment, you'll hear Louise Wilmot, our senior nurse practitioner, expand on those specifics. Many experts are also recommending that residents age 5 and up should get vaccinated, and if eligible, get your booster shot to fight against the COVID-19 variants. And as your mayor, I want to encourage everyone who wants to get a vaccination to please do so. And I want to remind the community that COVID-19 vaccines are readily available throughout the city, and our team stands ready to assist you. We need to work together to continue to ensure public health. And remember, we can help stop this pattern by increasing the vaccination rate in our community, and you will hear us continue to say that. So please, again, don't let your guard down. Get vaccinated, get informed, ask questions, and you can do so by going to our website on our city website. If you're vaccinated, please remember, if it's been over 6 months, you can get your 3rd dose or your booster dose. I guess the last thing I want to say is that, again, the variant has been detected in Texas, as was mentioned earlier, but this is not a reason to panic. We know what works, and we know what to do. So get fully vaccinated, get your booster, make good decisions for you and your family, and that in itself will keep Corpus Christi healthy and safe. So thank you very much, and next we will hear from Louise Wilmot.
Quiero recordarles a los residentes que contamos con herramientas para luchar contra el COVID-19 y sus variantes. Tenemos pruebas, vacunas para mayores de 5 años y dosis de refuerzo para mayores de 18 años. Aumenta también la temporada del COVID y la gripe. Los funcionarios de salud indican que no ha habido un aumento importante en los casos de COVID-19. La semana pasada informé que la gripe no ha afectado mucho a Texas como lo ha hecho en otros estados circundantes. Aunque esa información ya ha cambiado, los médicos han notado que la temporada de influenza ha comenzado. Los números están aumentando en Texas. Tanto los casos de COVID-19 como de gripe podrían aumentar aquí a medida de que más personas viajen y se reúnan durante las vacaciones. Los expertos continúan recomendando que tome todas sus medidas sanitarias de precaución y evitar así contagios de ambos, el COVID y la gripe. Los hospitales están experimentando un lento aumento en los casos de COVID-19, pero los médicos recomiendan vacunarse contra el flu y el COVID para evitar así hospitalizaciones innecesarias. Hasta el día de ayer han habido 2 casos geosecuenciados en San Antonio. El Distrito de Salud indica que esa variante parece tener un proceso de enfermedad más débil que el coronavirus original y otras variantes. Muchos expertos recomiendan que los residentes de 5 años en adelante se vacunen y si son elegibles, reciban una vacuna de refuerzo para luchar contra las variantes del COVID-19. Como su alcalde, quiero exhortar a los residentes en vacunarse. Las vacunas están disponibles en toda la ciudad y que nuestro equipo está listo para ayudarlo.
Luis Wilmot, Assistant Director of Public Health. Like the Mayor mentioned, we want to give you a quick update on the Omicron variant and its potential spread to our community. I'm going to go through some cases with you and see how it is, how we're monitoring the situation. This first slide here is our monthly case count. As you can see, we've had our peaks in the summer and the winter and this last summer. We've gone down significantly. In the month of December, we've had 743 cases thus far. That does increase. I mean, we do see an increase compared to the previous month. At this current rate, we should be hitting about 1,400 for the month of December, compared to the 985 that we saw in the month of November. So not a significant jump, but enough to say, hey, let's take a better look at this. So next slide, please. As you can see, these are the weekly case counts. The previous week from November 29th to the December 5th, that was a little concerning. We saw a little uptick there. We thought that, hey, this might be the beginning of something. This previous week, we saw a decrease to 329. So again, we're kind of stabilizing at that area. Not so much a significant jump that at this point that we're seeing here locally to say, hey, we have Omicron or more virulent virus here in the area that is going to increase spread. But again, we are monitoring that very closely. Next slide. This depicts the amount of deaths that we had in the month of December. We do have 8. Again, it's a sharp decrease from our peak in summer, September of this year. So good. We like to see that. Still, 8 is 8 too many. As of actually today, we have 39 people hospitalized. We have 16 people in the ICU and 10 on the vent. That has been relatively stable as well. We have seen maybe a slight uptick there. We are continuing to monitoring that, and as soon as anything like that happens, any kind of trends, we will be first to know about it. Next slide. Your Corpus Christi Public Health District has administered a significant amount of vaccinations. We're over 187,000 to date. The majority of those are Moderna, vaccinated over 137,000. Then we have our Johnson & Johnson 9,000, our Pfizer dose of 38,000, and now our pediatric doses. We've vaccinated over 2,800 pediatrics ages between 5 and 11. So we're ticking away at that. We're ticking away, and we're going to continue to tick away so long as the population demands for it. Next slide. We are seeing a jump in our boosters. People are getting the message. We've done a total of over 17,000 boosters at our sites. So we encourage the community to continue coming out. We are sending alerts through our system called Luminaire and also through our reverse alert system with the city to say, hey, you're due for an injection. Come on to any one of these sites. So please look out for those from the city. Here's our current vaccination rates. Total population for Nueces County, we're averaging about 53.8% fully vaccinated. So that's half of the population that, a little over half that is protected. We could do so much better. The kids just started over the age of 5. We're looking at 57%. If you include them as an eligible population, we're about 57.3% vaccinated. And you can see the 12-year-olds and the 65. I guess, listen to your elders. Look at our elders. They're 65 and older of the eligible population. They're 80% fully vaccinated. So I'm reassured by that number. Let's listen to grandma, grandpa, our elders, and let's make sure we're following them, and they'll lead us to success. These are the rates compared from the months of the vaccinations. You see October, November, and December. December today, we're at 8,600. Pending that continues, we're going to be over 16,000 vaccinations. So you can see the demand has come up. So again, we're going to continue to support that mission. The Omicron variant, this variant of concern. The variant has a large number of mutations, on the spike protein. What does that mean? That means there's a lot more changes that our body has not seen before, right? Some of these mutations some of them are similar to previous variants of concern, but some are new, and that's the ones we're most concerned about. Some computer modeling suggests that the variant may also escape immunity, whether it's vaccination immunity or if you've been previously sick or infected with COVID-19. We're going to continue to monitor that, and you'll see on the next slide where we're monitoring it through our vaccine breakthrough cases. These mutations, may also increase the risk of reinfection with this variant compared to the previous variants of concern. And the relatively small number of cases so far documented to date makes it difficult to estimate that. So we're still looking at other countries and seeing, hey, what are y'all seeing there? How is this affecting your population? How is this spread? So we can kind of look at that as a model for ours, because we know it's coming. It's coming. We need to prepare for it. Next slide. Again, we're going to be monitoring these vaccine breakthrough cases. Currently, we have 1,740 cases, that have been infected, even though they're vaccinated. This number here, if we start seeing a change in this is going to cause a red flag for us. At that point, we're going to focus on how bad is the infection. Is it a mild case, or our hospital is going to be overwhelmed again? Obviously, if our hospitals are going to be overwhelmed, or our ERs, then we're going to jump into action, and we're going to offer some treatment in the form of rapid infusions if necessary. But again, that's going to be our method of monitoring how severe, how should we react in the future. Next slide. So new CDC warnings that just came out. The CDC has warned against not to travel to Italy due to a very high contagious risk. If you remember early on in the pandemic, Italy was hit pretty hard. So, those folks have some immunity. Some of them have some immunity, whether through vaccination or infection. And right now, they're seeing a significant uptick. So for the CDC to warn and say, hey, stay away from Italy, that's a significant finding. For the week ending in December 4th, Omicron constituted 0.4% of all variants in the United States. 0.4, very minimal, okay? 1 week later, 7 days later, it is now 2.9%. That's a significant jump, right? At this level, we're looking at, almost 25% or more. So again, these are type of statistics, and Dr. Burr will do a better job at computer modeling and what we can expect. But this is a concern for us right now. To date, over 35 states have detected at least one case of Omicron in their area. New York just found out that Cornell University, they stopped students from coming to school. They shut down the university, due to rapid spread of coronavirus in the area. Over 500 cases were identified now, so they had to react. That's concerning. To date, in the state of Texas, we know Houston has been affected. We know San Antonio has a case, and now Tarrant County has also detected a case of Omicron. Omicron is on the way, right? We know this. It's now time to prepare. So, next slide, please. So don't panic, right? This is not our first rodeo. We've been going through this before. Let's go back to the basics. Let's go back to fundamentals, what works, Of course, we're going to continue pushing vaccinations. If you're not vaccinating, you think about doing that, now's the time to do it. It takes a couple of weeks to get that vaccination, that immunity built up. If you already fully vaccinated with Moderna, and it's been 6 months and you're 18 years and older, go get your booster. If you're fully vaccinated with Pfizer, it's been 6 months, and you're 16 years and older, go get your booster. Fully vaccinated for J&J, you can get it 2 months after, get your booster 2 months after, and you have to be 18 years and older. If you're considering getting your children vaccinated, now is the time to do it. Ages 5 and up are eligible for that vaccine. Take advantage of that, protect your children. odds are they're going to probably do just fine if they happen to get infected. However, they go home and kiss grandma and grandpa, and now you're affecting folks who are more immunocompromised and unable to fight the infection off as good as others. Again, fundamentals. I see often now, we've come very lax. People are not using their masks anymore. It's like, hey, if you're in a congregate setting, please put your mask. If you're going to go eat, please take the time to wash your hands before putting food in your mouth, before touching your face. Stop touching your face. These are basics that really did help us in the beginning of this pandemic. We need to go back to those fundamentals. They will help us out. So wash your hands often. As far as sick, we're about to go into the holidays. We're going to have little parties, get-togethers with the family and friends. If you are sick, do them a favor. That's the best gift you can give them, by not showing up to that party. Say, hey, you know what? I'm sick, guys. I'll be with you in spirit. Let me get over this. Let me get tested for COVID-19. Make sure it's not COVID, and then deal with it, right? So we'll have plenty of time to have more parties after the fact. But spreading this at a party is not going to help us out. Get tested as soon as possible. You start getting symptomatic, you should not be running to work. Hey, let your supervisor say, hey, I'm not feeling very well. I don't want to get anybody sick at work. Let me go get tested, get the clean bill of health, so you can go back to doing what you do. Next slide. So, again, as the mayor mentioned, we have our COVID clinics throughout the city. These are our static sites out there: La Palmera Mall, the Greenwood Senior Center, the Robstown Outlet, the previous Nike store, the Physicians West building in front of Old Memorial Hospital, and inside the Nueces County Courthouse, as well as the City Hall. So utilize those. I know, hey, you guys are going to go renew your registrations. You have access to vaccine right there at the courthouse. You're going to come over here and pay a bill at the city. You have access to vaccine right here in the rotunda. So take advantage of that access. We also have other COVID vaccination clinics that we're rotating throughout various areas. The QSR Legacy Center, Legacy Event Center is still on board on Mondays. On Tuesdays and Thursdays, we have the Goodwill Clearance Center, the Goodwill Clearance Store, and on Wednesdays, we have the Fallas Parking Lot. Well, I invite you guys to go to the Corpus Christi website, the City of Corpus Christi website. We have all listed there with the dates and times so that you can go at the correct time. We have done tremendous work recently with the local ISDs. Thank you, CCISD, for allowing us to partner with you and help bring these vaccinations to the children in the schools pending parental consent. We've done over 504 in the past 3 weeks of the schools, so that's wonderful. We will return for the second dose in the first 3 weeks of January, and we're also working with CCISD to continue doing. They have over 35 elementary schools. We've only targeted 15. We targeted first the most populated, but now we're going to extend that to everybody if they're willing to. We're also working with Flower Bluff ISD, Banqueta in the rural areas, Petronila. We're reaching out to these folks to say, how can we help you out and get your children vaccinated? Pending your questions, I'm sorry, that concludes my brief, and pending Gabby's translation, we're going to be followed by Dr. Bird from Texas A&M Corpus Christi.
El número de casos positivos en lo que va del mes de diciembre es de 743, comparado al mayor número de casos el pasado mes de agosto, que reportó 11,945 casos. En lo que va del mes se reporta un total de 8 fallecimientos. El pasado mes de septiembre fue el mes con mayor número de fallecimientos, reportando 180. El total de vacunas administradas en el condado de Nueces es de 187,484, la mayoría de la farmacéutica Moderna. El total de vacunas de refuerzo ha sido de 17,713. Se estima que el 53,8% de la población elegible a la vacuna está completamente vacunada. Entre las características de la variante Omicron se encuentra que la variante tiene una gran cantidad de mutaciones. Algunas de estas mutaciones son similares a variantes de preocupación anteriores. El modelado por computadora sugiere que la variante también puede escapar la inmunidad. Estas mutaciones también pueden aumentar el riesgo de reinfección. El número relativamente pequeño de casos documentados hasta la fecha hace que sea difícil estimar la virulencia. Los Centros del Control de Enfermedades, o CDC, advierten sobre los viajes a Italia debido al alto riesgo de contagio. Para la semana que finalizó el 4 de diciembre, Omicron constituyó el 0,4% de todas las variantes de los Estados Unidos. Para la semana que finaliza el 11 de diciembre, se estima que Omicron representa el 2.9% de las variantes de COVID en los Estados Unidos. Hasta la fecha, 35 estados han detectado al menos un caso de Omicron en su área. Hasta la fecha, Houston, San Antonio y Dallas han detectado al menos un caso de Omicron en su área. Si no está vacunado, ahora es el momento de hacerlo. Si está completamente vacunado con Moderna, obtenga su refuerzo 6 meses después de su segunda vacuna, solo si tiene 18 años o más, o 16 años para la vacuna Pfizer. Si está completamente vacunado con Johnson & Johnson, obtenga su refuerzo 2 meses después de su vacuna, solo si tiene 18 años o más. Vacune a sus hijos de 5 años o más. Recuerde que se necesitan 2 semanas para desarrollar la inmunidad. Se le recuerda tomar todas sus medidas sanitarias de precaución.
Good evening, everybody. Can you hear me okay through the microphone? All right. My name is Dr. Chris Bird, and I'm here to deliver the weekly pandemic report. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. We have 2 objectives. One is to address your concerns and questions about COVID-19, and 2 is to enable evidence-based decision-making on behalf of our local leaders. We're going to get right into it. First off is the transmission rate is right near 1. That means COVID cases are accumulating at about the same rate each week. If 100 people get COVID, then they transmit it to an additional 97 people right now. And what you see in the graphic is the calibration of our model against the data. The black is the actual data, the number of cases that we've seen in the community, and the orange is the number of infections that the model is estimating. And you can see that they overlap very nicely. That indicates that we have a good fit on our model, and that's how we can infer this transmission rate. We can also infer the number of hospitalizations here. In black, you have the actual number of people with COVID-19 in our hospitals right now, which is 65. And in the red, you have the model fit to that data. And right now, from last week, we're seeing a little bit of an increase in hospitalizations, an increase of 30%. If you look at the graphic, it's a very small number, but percentage-wise, it is a meaningful increase in the number of hospitalizations this week. And we're going to keep a close eye on that. Second, fatalities are declining. They're continuing to decline, so that is a positive development, and hopefully that continues. And if you notice, I have cut off any projection, and it's because due to the Omicron variants, I don't think this model is going to do a very good job of projecting what's going to happen next. What I am doing is showing this model, which is put together by the University of Washington. It's the premier epidemiological modeling organization in the United States, and this is for the state of Texas, and we have 3 scenarios. One where we have the projection sans Omicron, one where we have everybody masking, where the cases go down to almost 0, that's in the green at the bottom, and one which a few weeks ago seemed unlikely, but now seems much, much more likely, which is the worst case scenario where they're modeling no masking and 2x transmission. This model was, or this scenario was proposed before we knew about Omicron, but now this is the best projection that we have now about what Omicron's going to do. Once I have enough information to put together a better projection than this for our local community, I'll do it. I would not pay attention to the timing of the peak. I would just pay attention to how big it is, and it looks like it can potentially be as big as the summer of 2021 peak, which was substantial and pushed our hospital system right to the edge of its capacity. Okay, so moving on to Omicron. Right now, this is what we're really concerned about. And so we have substantial data now that Omicron is highly contagious, much more contagious than any previous variant that we've encountered. The graphic here is from South Africa. I've been showing it for the past 3 presentations, and every week that I've shown it, the number of cases per week has doubled. And just in this past week, it was at just over 100,000 cases in 1 week. These are new cases. And this week, if trends go according to the way they've been, it'll be at 200,000 by the time I'm presenting next week. I think we're getting into the realm of space here where the capacity of the system to monitor cases is probably going to get overwhelmed. I think you'll remember that happened to us here in the summer of 2020 when we had our first big spike. We overwhelmed the testing system in the first place. So you're going to start to see reports of maybe in South Africa a peak, but it might be premature because you have to remember that the system in place to measure the number of cases can only handle so many cases. And at this doubling rate, it's quickly going to go past that capacity. And there already was a report of a false peak in South Africa. So I want you to view that information with a degree of skepticism. Okay. And I want to show here the difference, how fast the Omicron cases are rising. It took 11 weeks for the Delta peak to go to 100,000 cases per week. In South Africa, Omicron only took 4 weeks, maybe 3, depending upon how you look at that. So it's substantially more contagious. And that's why we're so concerned. Now, last week I said, well, let's not jump to conclusions yet because sometimes you'll see a new variant pop up in a country and it never gets really out of that country. It blows up in that country, in this case, South Africa, and then we don't see it anywhere else. So I said, let's watch and see what happens in other places. Well, in the past week, we've watched and see what happens, and Omicron is spreading like crazy in the United Kingdom. In London today, over 60% of cases were due to Omicron. Only a couple days ago, it was only 40%, so it's really rising there. It's also rising in Norway. It's rising in Denmark. And it's rising right here in the United States, as you heard from Luis Wilmot earlier. So we've looked. Omicron is not just spreading like crazy in South Africa. It is also spreading extremely rapidly in several other countries, including now the United States. So now we're concerned. Now we can start to be sure that this Omicron wave is coming. This is a graphic showing the variants in the United States. The orange is Delta, the purple is Omicron. And what you'll notice is that in the New York region, about 13% of all the cases are Omicron right now. And here in Texas and the southern US, southern and central United States, about 3% of all the cases are Omicron right now. As you heard Luis Wilmot say, that based upon the rate of increase, we're looking at anywhere from 6 to 20% in Texas next week if the trend continues as it has, and even higher in the New York area. So this is where we get into the nuances of what's going to happen here. We know that an Omicron wave is happening, and it's coming, but what does that mean ultimately? So first, there's evidence mounting that Omicron infections are less severe than Delta infections, and that is positive news. But I want to caution everybody that just because the risk of hospitalization might be up to 29% lower, which is the best data that I'm seeing coming out right now than previous variants, that doesn't mean that we really know that there won't be an impact on the hospitals. All right, second, the vaccinated and recovered are at a lower risk of severe infection. We have seen data that indicate that. So that is also a positive development. And if there's no other reason to get vaccinated right now, it would be because it will protect you against severe infection, has a high probability of protecting you against severe infection. However, so those were the positive aspects of this. The negative aspect of this is it looks like right now, based upon the data that we're seeing, it's not just computer modeling, it's also data directly from South Africa, which indicates that the majority of vaccinated and recovered people are susceptible to Omicron. What that means is that you can catch it. It means that you're not immune from it. Most people that are vaccinated, most people that are recovered are susceptible to an Omicron infection. And so we know, that's why we know the wave is coming. There's a large wave of infections that are coming. What we're not sure of is if that large wave of infections is going to hit our hospitals or if it will hopefully miss them. So that's what we'll be updating you on. So how do you process all this information and how do you use that to adjust your behavior? Well, avoiding, masking, and vaccinating are your 3 steps here to really ensure that you're combating Omicron as good as you can. 1, if you avoid crowded areas, you avoid coming into contact with Omicron. Social distance, try to avoid going to large events with a lot of people. 2, masking reduces infections. Masking is very, very effective at preventing you from contracting COVID, 80 to 90%. And if 2 people are wearing their masks, even higher. So that gives you substantial protection. 3, vaccination reduces the amount of severe symptoms. It reduces your chances of going to the hospital. It reduces your chances of fatality if you should become infected with Omicron. So this is that Swiss cheese model. If you're doing these multiple different interventions to try to prevent yourself from contracting or spreading COVID, then that will help us to combat Omicron. I do want to point out that right now, the data indicates that there might be limited protection against infection from the vaccinations. That doesn't mean that the vaccines don't work. The vaccines are preventing you from going to the hospital. They're preventing you from dying due to Omicron. Okay, so in summary, 1, cases, hospitalizations, and fatalities right now are really low, but we're really expecting the cases to start ramping up. Right now in Texas and the southern United States, Omicron is about 3% of all cases, and a large wave is projected to occur. The impact on hospitals is uncertain, and so that's where we're not sure how big of an impact this is really going to have directly on our community. Here's what I do feel fairly comfortable saying as an evolutionary biologist. If we let the Omicron wave spread around the world and infect millions and millions of people, there's going to be another variant that comes behind it. And it will most likely be, in terms of a virus, more effective at either infecting us or might be more virulent. And if for no other reason, we're trying to stop that from happening. So even if you are not worried about contracting Omicron or getting a cold from Omicron, if you think you're healthy and you're not going to have a lot of symptoms, you can help to stop the evolution of COVID by masking up and doing all these things to prevent its spread and stop it from infecting millions of people. All right, so recommendations: avoid, mask, vax. It's as simple as that. If you're symptomatic, self-isolate immediately, get tested. If you're positive, immediately go and get the monoclonal antibodies. The monoclonal antibodies, in the studies that I've seen so far, are effective at addressing an Omicron infection, and they decrease your chances of hospitalization even further. Once you're in the hospital, it's too late, and I can't stress enough that these monoclonal antibodies are free for us here in the Coastal Bend. If you were to live in another part of the country, it'd be a very expensive treatment, but here we get that for free. So that's our report for this week. We should be back next week. We'll go to a translation, and then Luis will come up and address any questions that you might have. Thank you.
El radio de transmisión del virus continúa al mismo nivel, al 0.97, o sea que si 100 personas están enfermas, pueden contagiar a 97 adicionales. El censo de números de pacientes hospitalizados con el coronavirus ha aumentado un 30%, aunque aún no se cuenta con suficiente información para pronosticar el efecto por la variante Omicron. El número de decesos también ha disminuido. ¿Qué se espera durante este invierno en el estado? Que la transmisión del virus puede ser el doble si las personas no utilizan al menos un cubrebocas, pero esa transmisión pudiera disminuir hasta un 95% si las personas los usan. Se sabe que la variante Omicron es altamente contagiosa. A la variante Delta le tomó 11 semanas llegar a 100,000 casos, mientras que a la variante Omicron le tomó solo 4 semanas llegar a los 100,000 casos en Sudáfrica. Omicron se está expandiendo rápidamente a otros países europeos, incluyendo al Reino Unido, Dinamarca, Noruega y la ciudad de Nueva York. El impacto que pudiera tener la variante Omicron en los hospitales aún es incierto, pero cada vez hay más pruebas de que las infecciones por Omicron son menos graves que las de Delta. El riesgo de hospitalización es hasta de un 29% menor. Las personas vacunadas y que se han recuperado tienen un menor riesgo de contraer una infección severa. Sin embargo, la mayoría de las personas vacunadas y recuperadas son susceptibles a la infección por Omicron. Se proyecta una gran ola de infecciones para el periodo de diciembre a febrero. Se le recomienda el uso de cubrebocas y tomar la vacuna. Si cuenta con síntomas, aíslese, hágase la prueba y si resulta positivo, obtenga el tratamiento de anticuerpos monoclonales.
Thank you, Gabby. So this concludes our brief, pending your questions. All right, thank you so much for joining us tonight, and we appreciate you. Thank you.